So today we're going to talk about a case of a person who's in their 30s, spending 12 months feeling like they're dizzy, off balance every single day. We're going to walk through what we found and how we were able to help him fix this problem. My name is Dr. Nathan Kaiser here at the Kaiser Clinic in Chelsea, Michigan. We help people who have neurological injuries feel better. Here's Dr. Erin Kipros. She's going to walk you through exactly the progression of this case.
So today we're going to talk about this patient who came to us and his chief complaint was feeling off balance. So he felt dizzy, he felt lightheaded when he would change position specifically. He also reported that along with these things, he would experience brain fog, he would have difficulties holding a conversation, he would experience blurriness in his vision when he was working or when he was in crowds, and he was also having a lot of trouble sleeping as well as exercise intolerance. Interesting for him is that when the symptoms started, he was actually at the gym working out. He felt himself getting a little dizzy, feeling off balance. He thought it was just due to the workout, thought if he went home, slept it off, it would go away. But a year later, it hadn't, and that's what brought him to the clinic. He also mentioned that he experienced a lot of tension in his neck. So when he would turn his head right and left, he felt like his neck was locked up and stiff. When he came in, we went through a series of tests. We did a physical exam, we did an autonomic tilt table test, we did video oculometry, and we also used a saccodometer to track saccadic eye movements. So when we were going through the examination, we found that his sensory exam was pretty normal, and as well as his reflexes. We did find that when he did finger, nose, finger testing, with his right hand, he would overshoot to the right, so he wasn't accurate with that test. We also noticed that his Romberg's test, so when he stood up, closed eyes and feet together, he would sway like he was gonna fall over to the right-hand side. We also noticed that when he would walk, he would step out, so do a wide gait with his right foot, and he would veer in that direction. When we added a dual task, so we had him do something else while he was walking, we had him say every other letter of the alphabet, we noticed that his right arm swing actually decreased. What we did then is we had him do figure 8 movements while he did the same procedure, and we noticed that the sway and his subjective feeling like he was veering over to the right-hand side went away. So after we did that, we took a look at the patient eyes bedside and we found that his VOR, or vestibulo-ocular reflex, wasn't working the way it was supposed to, so it was maladapted. What this means is when we turned his head, your eyes should have a reflexive movement to go the other way to keep your eyes locked on a target. But when we turned his head right, his eyes would not reflexively move. He had trouble finding and keeping his eyes on the target. We saw that his neck was very hypertonic, so we had a lot of hypertonicity in the muscles on the right side. So we started to think that the neck could be compensating for the lack of signal from the vestibular system on the right-hand side. When we did autonomic tilt table testing, what we found is that when the patient went from a supine or laying down position up to 70 degrees of tilt, it took 2 minutes for his body to recognize where he was and put the proper reflexes in place to keep blood in his head. So he had cerebral hypoperfusion. So when we think about putting these things together, not getting good input from the vestibular system and changing position on the tilt table, both of which were having reflexes that aren't accurately sensing where you are. So once we did our exam, we figured out that we were gonna have a threefold treatment plan for this. First, we needed to rehab the vestibular system. So we needed to balance out the input that was coming from the right and the left side of the vestibular system. Then we needed to mobilize the cervical spine, so make sure that we were getting the spine moving. And then after that, we were gonna integrate tilt oscillation, so practice tilts to make sure the reflex that allows you to change position in space, go upright, everything that needs to happen with the autonomic nervous system at that place was kicking in. When we're thinking about rehabbing the vestibular system, for him, we know that there was less signal coming from the right vestibular system. When the signals on both sides are equal, we're able to sense that we are still or not moving. When they're unequal, we're gonna feel like we're moving, even though we may not be. So for him, having a decreased signal on the right-hand side, we wanted to increase that signal. So we started spinning him to the right while his vision was occluded. And what we were looking for is for him to have what we call an optokinetic reflex. So this is the reflex you have when you spin or even when cars are driving by and your eyes boom, 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 boom. At first, it wasn't great, but then as we did it more and more and the signal from the vestibular system increased, we were able to see that reflex kick back in. Once he had that reflex, we took off the occlusion. We allowed him to see while we were spinning him. We also added in rightward head rotations. We wanted to first rehab the vestibular system, and then we were gonna add in the neck in order to rehabilitate the VOR, or the vestibulo-ocular reflex. So he had him doing quick head rotations to the right, slow back to middle, in order to increase the signal from this side and get the eyes to move reflexively in the opposite direction. Once the vestibular system was working the way we wanted it to, we started to mobilize the neck. So we started to get that moving and decreasing the hypertonicity that was compensating for the decreased vestibular input on the right-hand side. Overall, after a year of feeling off balance, he was able to walk out of the clinic feeling like he knew where his body was in space. He no longer veered over to the right. He could change positions without feeling lightheaded or feeling like he was gonna fall over. And he was able to start doing the activities in his day that he actually enjoyed and needed to be able to do.